Antibiotic has played a significant role in reducing the burden of communicable disease globally. However, with the emergence of antimicrobial resistance, which poses a global challenge even to address the most common communicable diseases we have been treating so far. MSF has acknowledged this challenge and has been working on mainly three pillars to address the issues of antimicrobials in our project locations. The first pillar that we are working on is to provide adequate IPC in our facilities. With having a proper infection prevention and control mechanism will reduce significantly the transmission of disease inside our facility. Second pillar that we are working on is antibiotic stewardship. With this, we avoid misuse of antibiotic, overuse of antibiotic, and irrational prescription. Point prevalence survey has been conducted to see the prescription pattern inside our facilities, in Bentu particularly. We have done a lot to address or improve the IPC in our facility in Bentu since 2018. We ran 2-point prevalence surveys so far and found out that ceftriaxone is the commonest antibiotic being prescribed in the two surveys. Thank you very much. Wish you a very happy Paediatric Day.
Bentu POC is one of MSF projects in South Sudan with 136 bed capacity. As you know, in order to reduce resistance of antibiotics, we are more concerned about IPC, antibiotic stewardship, and diagnostic tools. I'm going to be more focused on antibiotic stewardship. We have been observing in different projects too many patients who are not responding to antibiotics, especially pediatric patients. They are not responding to ampicillin, they are not responding to gentamicin, even for this combination. And you need to go to ceftriaxone or amikacin, all these kind of drugs. Unfortunately, with this technique, we are going to develop resistance in near future for these antibiotics. So we are more focused in clinical reasoning. We are also focused in rational use of antibiotics. The goals for all these things is to optimize clinical outcomes, is to minimize side effect of antibiotics, to minimize resistance, to minimize toxicity. And the last goals is to reduce the cost.
Speaking here about point prevalence survey of antimicrobial resistance conducted in Bentu POC Hospital, South Sudan. In 2019, there were 153 cases included, and in 2020, there were 82 cases included. All patients which have been in admission to all the wards and the secondary hospital were included in the point prevalence survey. All patients which have been in admission into all these wards were included, and data was collected by reviewing the patient medical records using a standardized questionnaire. There was some challenge during the point prevalence survey. The main challenge was the number of patients which have been admission during the PPS was small, and also incomplete information on some of the variables and information needed was also another challenge. The antimicrobial resistance point prevalence survey has come with some opportunities for quality improvement and utilization of antimicrobials, and also it has created an opportunity for further teaching and capacity building and the staffs. Thank you very much.
I will be brief, straightforward in comparison of CIPCA improvement plan beginning from 2019, 2020 and 2021. So let's say right now in the projects we have IPC committee that comprise of the heads of the departments, the NAMs, the clinical lead, the nurse lead, and hospital coordinator, plus wards and manager. So we normally have IPC committee meeting bi-weekly, every 2 weeks, where we sit together and see the challenges we address, and we reinforce most of the IPC tasks. So let me go straight forward to the answer gene. Right now we have hand-washing point almost everywhere in the hospital. Beginning from the gate, the entrance, we have hand-washing point. Again, in each ward, we have hand sanitizers. When staff are doing ward round, they have to make sure that they perform hand hygiene using alcohol gel. We put it almost on every bed, but we prioritize high-risk areas like neonates and maternity. So now we have a checklist. Let's say we have auditing tool for hand hygiene. We normally move from ward to ward after 15 minutes, and then we collect the data. We share with the team based on the feedback, from the dashboard. Right now, the feedback from the first answer gene auditing was like good. Right now, let's come to the environmental hygiene. Let's say that our cleaners are doing very hard. We have most of our disinfectant and detergent in the projects. We have detergent soap, we have chlorine, we have saponios and Xenas. We prioritize the high touch areas, the bed rails, the tables and everything. They're actually doing that in daily basis. The schedule for deep cleaning goes every 6 months with IRS. That's what we are doing. Where we sterilize all the medical sets, the medical materials, mostly the forceps and everything. Yeah, we follow the MSF protocols, based on the green area, the dirty zone and clean zone. Yeah, so we normally schedule training for the staff. IPC training are there. We normally do it after 3 months. When we come to the capacity of the isolation, to isolate the staff with communicable diseases, we have COVID isolation, we have TB isolation. When we come to droplet precaution, staff are wearing face shield, on daily basis. We have face masks, surgical masks and N95 masks, most of them are used in isolation. The bed space, yes, 1 meter, from each bed. Yeah, we have already reinforced that. The bed occupancy, only 1 patient per 1 bed. We don't mix 2 patients in the same bed. No, that's it. That's it about the SIPCA improvement plan. There are a lot of things to be improved, in coming future. Let's say we are trying to improve more, to make sure that we take good care of the safety of our patients and our healthcare workers in the project. Thank you so much.